I've had people ask me, how do pediatricians feel about all these vaccine changes? And the answer is not great. This idea of informed consent and shared decision making is not new. It's misleading to think that it is. We've been doing this for a long time when it comes to vaccines. We're concerned about the fact that these changes were not made with Americans in mind and keeping in mind how unique Americans are and the things that Americans really need. It's also going to be really interesting to watch how access to vaccines changes, and we're worried that families aren't going to have access to vaccines because if your pediatrician recommends that your child gets the flu shot, for example, but it's not recommended, how is insurance going to cover that? Also, there was no consideration in these changes for how much more we're going to see these diseases in our communities, and our communities could become a lot sicker. We shouldn't be making changes without considering that the whole reason these vaccines were made was to prevent these diseases, and the vaccines really aren't the problem. It's these terrible diseases that can make kids sick or hospitalized or even die. And the hardest thing is just seeing families also overwhelmed, confused, and scared about what to do with vaccination. And so I want you to know that pediatricians are not confused. We are going to be recommending a vaccine schedule for Americans. So go to the American Academy of Pediatrics, look at their resources, and follow their recommendations for your childhood vaccines.